A phase 3 trial Sebelipase, Alfa and Lysosomal acid Lypase deficiency. Introduction. Lysosomal acid Lypase is essential lipid metabolizing enzyme that break down endocytosid lipid particles and regulate lipid metabolism. Investigators conducted a phase 3 trial of enzyme replacement therapy in children and adults with lysosomal acid Lypase deficiency, an underrepresented cause of cirrhosis and severe dyslipidemia.
My name is Mark Goldberg. I'm Executive Vice President for Medical and Regulatory Strategy at Synergy Biopharma. We're studying lysosomal acid lipase deficiency, which is an autosomal recessive disease due to mutations in both alleles of the gene that encodes lysosomal acid lipase. This enzyme is critical in cholesterol metabolism. When an LDL particle binds to the LDL receptor and gets taken up by the cell, the cholesterol esters and the triglycerides within the particle are hydrolyzed within the lysosome into free cholesterol and free fatty acids. And when this enzyme is deficient or absent, there's a dramatic increase in the amount of lipids that accumulate in the lysosomes of the cells throughout the body, but particular in cells of monocyte macrophage lineage and hepatocytes. This leads to progressive accumulation of fat and steatosis in the liver, usually a microvesicular steatosis, that progresses to fibrosis and cirrhosis, and leads often to liver failure even in childhood. There's also a dyslipidemia marked by a high LDL and a low HDL and a variably elevated triglycerides that leads to accelerated atherosclerosis.
Application in medicine. In this multi-center, randomized, double-blind, placebo-controlled study involving 66 patients, we evaluated the safety and effectiveness of enzyme replacement therapy with Sebelipase Alfa, administered in IV form of that dose of 1 milligram of 1 kilogram every week.
We've got two presentations on a poster at the meeting. The first presentation is the results from a phase 3 study, which is a double-blind, placebo-controlled study in both children and adults with lysosomal acid lipase deficiency. The second presentation is a phase 2-3 study in infants with the most rapidly progressive form of the disease, which is typically lethal in the first 6 months of life. And then we have a poster which describes 2-year follow-up data on adults that were put into the first human study with Kanuma, and that's taken through to 2 years of treatment.
Issues in Ecuador. The placebo-controlled phase of the study was 20 weeks long and was followed by open-label treatment for all patients. The primary endpoint was normalization of alanine aminotransferase level.
This is a disease that we've probably misdiagnosed or underdiagnosed for many years, and it goes under the radar. Patients who have significant liver disease, fibrosis, and cirrhosis may be misdiagnosed as cryptogenic cirrhosis. A large number of patients may be labeled as fatty liver disease patients, and unless we can screen these patients and pick up this disease, we're not going to be able to offer them the treatment that will soon become available to this population. A very simple test for this disease is measurement of enzyme activity in dried blood spots. So it's a simple finger stick with a little bit of blood that goes on a piece of paper, and this test can be sent out to commercial labs. For example, LabCorp or Mayo both can test for this disease and give us a diagnosis of LALD.
Pro and cons. Pros. Secondary endpoint included additional disease-related efficacy, assessment, safety, and the side effect profile. Cons. Substantial disease burden at baseline included a very high level of low density lipoprotein cholesterol in 38 of 66 patients, and cirrhosis in 10 of 32 patients who underwent biopsy.
For those of us who see children, pediatric patients, lysosomal acid lipase deficiency is really very important. About 90% of all the cases that have been diagnosed to date occur in children. So this is primarily a pediatric disease. So the question is, if I'm a primary care doctor, if I'm a family practitioner, or general pediatrician, or maybe pediatric cardiologist, what am I going to look for? How will I know what this is when I see it? I think it boils down to three very simple things. The key to me, and I'm a lipidologist here, but the key to me, first and foremost, is hypercholesterolemia. I want to look for high cholesterol. And in kids, of course, we want to do kind of the age-corrected thing. And for a young child, it doesn't have to be that high to be really, really high in terms of percentile. But if we have a significantly elevated total cholesterol or LDL cholesterol, then that's key number one. And we're focusing on this familial hypercholesterolemia thing. We're trying to screen the kids for that. We're trying to do cascade screening of the family, the whole thing. That's wonderful. But realize that whenever you see somebody with what looks like familial hypercholesterolemia, off in the corner, you need to remember, could this be LDL deficiency masquerading as the typical case of FH? So the first piece, elevated LDL. Second piece, low HDL. Now, HDL tends to be just a little bit suppressed in FH, but it tends to be even a little bit lower in the cases that truly have LDL deficiency. So high LDL, low HDL. The third element here is elevated transaminases. The liver is hit very hard by this, and you look primarily with elevated transaminases. Now, if you're good at a physical exam and the patient will relax for you and you can get a good liver exam, you're going to look for hepatomegaly. Virtually everybody with LALD has a big liver. And in some ways, it's a little easier to pick up in kids than it is in adults. But I think the transaminases are actually even a little bit better than hepatomegaly, but look for both. Okay, so you've got those three elements. If you see that, then you say to yourself, this might be that rare disorder, LALD. So then what do? You have your choice either to send out to your local clinical lipidologist. There are pediatric lipidologists around the country. A lot of us that are in adult medicine that are clinical lipidologists will actually see children as part of our practice. So find one of us in your community and or somebody else in the National Lipid Association or just somebody else knowledgeable about lipids primarily or liver disorders. And then we'll do the screening, but you can do it. There are actually kits available. It's a dried blood spot. Send it off to the lab. It is free of charge. There's a kind pharmaceutical company that is paying for us to do these screens, so it's free. Can't get better than that. And it's completely definitive. There is no overlap whatsoever between normal and LDL deficiency. So we know for a fact if they have it. If they do, then we for sure need to refer off. And if they don't, then we go on our way. So to me, the most important piece here, this is a rare disease which is way underdiagnosed, way underappreciated. If we miss the diagnosis and it's picked up 10, 15, 20, 30 years later, then all that damage has occurred and the patient is way worse off than if we had thought about it when we had that chance. So as we screen our children for lipids, let's remember the high LDL, the low HDL, and then that transaminase piece that really doesn't belong with the other two if it's a standard FH case, or the hepatomegaly and or those two liver pieces don't belong with the other, that tells us refer for screening or screen and then refer if we make the diagnosis.
Conclusion. Sebelipase alpha therapy resulted in a reduction in multiple disease-related hepatic and lipid abnormalities in children and adults with lysosomal acid lipase deficiency.
Lysosomal acid lipase deficiency, or LALD, is a progressive and rare genetic disorder that leads to fat accumulation in the liver. It's caused by mutations or changes in the gene for the lysosomal acid lipase enzyme. It also results in abnormalities in the fats or lipids in the blood. LALD affects both males and females, and it affects individuals of all ages. LALD is a disorder that affects many different organ systems in the body. Infants with LALD have very serious and rapidly progressive symptoms, often beginning in the first few months of life. And these include failure to thrive, poor weight gain, enlargement of the abdomen, which is due to enlargement of the liver and spleen, and often gastrointestinal symptoms like diarrhea. In the absence of treatment, the condition progresses quite rapidly, and often children succumb to the disorder before their first birthday. LALD affects both children and adults by leading to progressive accumulation of fat in the liver with resulting inflammation of the liver, which ultimately leads to scarring, fibrosis, cirrhosis. The treatment for lysosomal acid lipase deficiency is what we refer to as enzyme replacement therapy. Patients are missing an enzyme called lysosomal acid lipase, and the treatment gives it back to them. So it corrects the underlying basic defect in the disorder. The benefits of the treatment appear to be very significant. So importantly, in the liver, we see a reduction in the fat accumulation in the liver as measured by imaging studies. We also see improvements in the blood tests that we do. I anticipate starting all of my patients on treatment just as quickly as possible.
¿O ya tienes tiempo?